I guess unfortunately the session ended due to some connection or network issue. I'll invite ma'am one more time.
Am I visible? Okay. Why aren't we able to join? It usually happens that due to some connection issue or network issue. I don't know why isn't happening.
Yes, I'm so sorry. There was some connectivity issue.
Yes, ma'am, from my side also.
hmm
I guess we'll have to start again.
That's fine. You can restart. That's okay.
Okay. So, hello everyone. This is me, Prerna Bajaj, your host for the today. And we have today a wonderful speaker that is Dr. Yatri Thakkar. She is a wonderful holistic homeopathic physician and has been serving for the past 20 years. She is based in Mumbai and she is also a Dada Sai Phalke awardee. So I would like you to, ma'am, start with the topic today as we proceed with the role of homeopathy and administering homeopathic based remedies in the field of psychiatry and anxiety.
Yes. Wonderful. Thank you so much, Prerna, for having me over. And especially, it's been my constant effort to spread patient education about mental health and psychosomatic disorders and the role of homeopathy. So, we
Hmm.
would request fellow homeopaths, students, anyone who wants to pursue homeopathy as a career to ask us any kind of questions you want to. And yeah, we will be able to answer as much as we can.
Yes. So, ma'am, we would like to start the session with introducing the topic that is what is anxiety and what causes anxiety, the signs and symptoms.
Mm. Yes, firstly, anxiety has risen by about 25% post COVID.
Hmm.
All the physician out there, the GP physicians, all doctors will vouch and say, yes, anxiety is something that has really increased. So, literally, 2 in 8 people, you will find them saying, Doctor, hame anxiety ho gayi hai.
Hmm.
But what is this anxiety? So, actually, anxiety is a body's way to prepare itself to fight from any kind of danger.
Hmm.
Okay. But when you are fighting that danger excessively, that's when the anxiety actually sets in.
Hmm.
And anxiety as a symptom is different, and anxiety neurosis as a disease is different.
Okay.
है ना? So, for
So,
example,
how do we separate both of them?
okay.
How do we
So,
separate both of them?
yes, that's what. So I was trying to give an example for same. For example,
Hmm.
when you know that your exams are coming and you're very
Hmm.
anxious about it, how will it be? So you know there is some danger, so you start preparing for it, right? But
Hmm.
that's good anxiety because you're preparing for it.
Hmm.
How will it go? How will it go? And once that task is done, then you know whether you've done well or not.
Hmm.
Correct? But say your exams are over, everything is over, and still you keep on thinking about it. I wish I wouldn't have
Hmm.
made that slightest mistake. I hope I get
Hmm.
full marks. I wish I don't fail. If I fail, my mother, father will slap me. So you keep
Hmm.
on being anxious and thinking that there is unreal danger. The brain, it starts perceiving as unreal
Hmm.
or imagined danger. That leads to
Hmm.
a disease. So there is difference between physiology, that means something comes
Okay.
and your body naturally reacts to it, and then something called
Hmm.
as pathology, and that's what the physicians or doctors treat the pathology, because that creates the disease,
Okay.
right?
So, ma'am, what are the signs and symptoms one should look for
Hmm.
to finally distinguish that these are the symptoms of anxiety and this is something very normal, like life-based or daily work, stress-based anxiety?
Yes. Before that, one should know, because we are just not talking to our fellow homeopaths today, this life. We are talking to
Hmm.
general public. So they should also know that when is the time they should go and contact a physician or a mental
Hmm.
health expert or a homeopath. Okay. So say there
Hmm.
are about 10 symptoms. If you
Okay.
suffer from five or more of these 10 symptoms for
Okay.
more than 2 weeks till 6 months,
Hmm.
then you should contact a physician. I'll make it very simple. Okay.
Hmm.
So, if you're having symptoms of irritability, if you're having symptoms
Okay.
of sudden worry, like too much worry, with that, if you have insomnia or sleeplessness with worry, you start getting
Hmm.
physical
Hmm.
aches and pains without any reason. If you
Hmm.
start having palpitation just at a thought, if you start having like sudden sweat or trembling just with a thought, okay, then in case if you are very sad and you're crying without reason, okay,
Hmm.
um,
Very common
then
one.
very, very, very common. If you are one of those who can't focus and is confused, or
Hmm.
even if you have suicidal thoughts,
Hmm.
right? Now, so many symptoms I gave. From that, if you have five symptoms or
Hmm.
more, which last for more than 2 weeks, then you should definitely take some help. Because we believe,
Hmm.
right? Prevention is better than cure,
Cure.
right? So go to a
Hmm.
physician as soon as possible and you will see the difference. Okay?
So, ma'am, how to approach and apply the principles or ideals of
Hmm.
homeopathy,
Hmm.
especially budding doctors or young doctors who are new into this field and they are learning
Hmm.
how to do a case taking. So, how to
Yeah.
approach with that portion while taking such cases?
Firstly, all those who are studying homeopathy, we have like a nice sutra in our hand. That means a weapon. You know what is that? Homeopathy actually works best on mind body connection,
Hmm.
right? And homeopathy's main principle, we all know, lies with the main thing of individualization. That means if
Hmm.
five people are suffering from anxiety, say they all
Hmm.
five are of the same sex, they all five of the same age also, but
Hmm.
they all will react to anxiety differently. Their signs and
Hmm.
symptoms would be different, right?
Yes, ma'am.
And accordingly, we will give a homeopathy remedy which suits that individual person. So, we as fellow homeopaths have that sutra or that miracle thing in our hand, which is called homeopathy, which
Hmm.
works brilliantly on mind and body. Okay.
Hmm.
Now, here comes the importance of case history. Why?
Okay.
Because that will help us to differentiate these five people from each other.
Okay.
Okay.
Hmm.
So ideally, when it's been about 21 years that I'm practicing, and classical homeopathy, where I've seen the difference. Of course, with a lot of complementary other therapy, which I'll come later, I'll talk about that. But today, let's just talk mainly
Hmm.
about classical homeopathy. Most important step towards
Okay.
reaching towards our remedy is first,
Hmm.
first, very important, are observing the non-verbals of the patient minute they enter in.
Taking.
Yes.
Hmm.
So that's where our case
Subjective and
history.
objective symptoms.
Absolutely. But you have to be like a
Hmm.
keen observer, and most important for
Hmm.
us, without judgment. If we
Hmm.
physicians, because of our past experience, are judging our patient
Hmm.
coming in, we won't be able to find the right remedy. Okay. So, firstly, is observe the non-verbals of the patient, and then
Hmm.
try and get into the core issue of the patient, the triggers and the core issues. And of course,
Hmm.
the most important differentiating factors for a remedy, in spite of a patient coming for a mental health issue, would be the physical symptoms for me. That's how I practice. And I get a
Hmm.
brilliant, it really helps you to filter out that single remedy that you want to give to your patients. Okay. And finally
Okay.
comes the confirmation. Okay. Let me give you an example. Okay.
Hmm.
Um, so I'm remembering right now this patient. She's around between 55 to 60 years old. Okay. She
Okay.
was again referred by another patient, and she had severe anxiety. Okay. So how did she
Okay.
come and tell me the symptoms? She did not say, I have anxiety, right?
Hmm.
So she came and she said, Doctor, since years, it's been 2 years plus post COVID, I get really scared of dark and I'm so nervous I cannot get out of my house. She was
Hmm.
so afraid of the dark that this 55-year-old lady at night, if she had to use the loo, she would wake her daughter in law up, who would hold her hand, take her to the bathroom, and then she would
Hmm.
go and use the loo. She was so scared. And minute of any thought that she would have about, something would happen to her, something would happen to her physically, she would feel like using the loo. That means she would have diarrhea. Okay.
Okay.
All those who
So
are
that was
watching
her
and are
way of.
homeopaths, I
Hmm.
want you to start
Hmm.
guessing this remedy. Okay, so I'll tell you how I reached to that. Okay, start guessing the remedy, including you, Prerna. You can type and write what the remedy is.
Okay, ma'am.
Okay. So this patient, she was, and then she also said, Doctor, so I said, what do you do the whole day? Because, she's just 55, 60-year old and how dependent she is. See, here comes the case history and the observation of a physician, right? So I said, what do you do the whole day? So she said, well, I just keep on thinking that what will happen to me? What if I step out and if I have a heart attack? What will happen to me
Okay.
if there is no one for me? And then with that, I would suddenly feel like chakkar, giddiness.
Hmm.
And then I would go to sleep and then I would feel a little better. Okay. With that, she had
Hmm.
other reflex issue. She also had a lot of bloating and, as you know, anxiety and nervousness. Come on. I'll give you literally 2, 3 seconds, guys. Anybody wants to know the remedy I gave, and then I'll tell you the follow up of the patient. Any guesses? Yeah. So that means no homeopath
And
is
I can
watching
also
this.
give
Of course.
uh 2 or 3 are coming. Like
One.
I can think about Ignatia also.
Mhm.
Uh, then not gelsemia, but few symptoms were little trivial from gelsemia as well. And aconite. No, 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 not aconite. Arsenic. Arsenic.
Yes, you were close with arsenic. So, how I would rule out the remedy? By the way, the remedy that I gave her was gelsemium. And all those who are
Gelsemia.
non-homeopaths, let me tell you, do not take this just off the shelf. Okay. There are a lot of detailed
Hmm.
history. I took for 40, 45 minutes and somebody else would take longer. And then we come to a remedy. Someone mentioned natramure. I'll tell you how I removed natramure and how I filtered. See, ignitia is usually with the main causative factor of some sudden shock leading to sadness.
Hmm.
And natramure comes which a chronic sadness. In this patient, it was not visible at all. It was all about
Okay.
nervousness, anxiety, with
Hmm.
that, the giddiness, right?
Hmm. Hmm. Hmm.
Right? So all of that, and then of course there were much more physical concomitants that helped me to get the remedy. Now I gave her, and
Hmm.
within 3 months, this lady, she started traveling alone. Forget daughter-in-law and all of that. Like I should literally take a video and put out here, right? So much better, and the amount of patients she has referred me, nothing like it. But more importantly, the patient was recovered. That's important for me, right? And us as
Hmm.
homeopaths. So that's the importance of case history. Case history without judgment, starting right from non-verbals, understanding the
Hmm.
core, and absolute individualize how different is this patient. Then when you are very, very like confused, 4, 5 remedies, start filtering it out. Okay.
Okay. Ma'am, how to use repertory in cases of psychiatric disorders? Like, which repertory, according to you, would be the best?
You want all my secrets out, huh? But
Tips and tricks.
right, right. So, I there is not one per se repertory that, though I like synthesis a lot. I love synthesis
Okay.
as a repertory because it is like a holistic thing, right?
Hmm.
I would sometimes consider the Shankaran philosophy, sometimes Humranwala, sometimes Dr. Master. Luckily, from the time when I passed, I had all these great international pioneers of homeopaths coming budding up, and I was very lucky to get
Hmm.
the insights from them. But synthesis is my favorite. I think it gives a holistic approach.
Okay. When somebody wrote something, case history without judgments and non-verbal.
Yes, 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 yes. We'll take the question. I think somebody is written, please give us tips. We'll definitely answer. Great.
So, ma'am, what is the final homeopathic approach for a doctor overall? Like, what to dispense, when to change the remedy, when to give an intercurrent remedy.
Yeah. Honestly, this comes a lot with clinical experience.
Okay.
Okay, about the potency, the
Hmm.
repetition, um, also about the intercurrent, in case no
Hmm.
sode or not. Sometimes in my
Hmm.
psychiatric I use no sodes. It is required a single no sode, and I see magic. Like doctors like, क्या patient like 15 दिन में कैसे, डॉक्टर हमको ये
Hmm.
एंजाइटी या जो भी फियर था, 15 days
Gone.
gone. Now, also over the years, I've realized that every
Hmm.
pathy has its own strengths and weakness,
Hmm.
right? And what is the best approach for us as physician? The best approach is whatever is beneficial to our patients. That should be our final goal. Leaving our egos aside about allopathy and Ayurveda and Unani and homeopathy, right? I believe in
Hmm.
collaborative work as well. For example, if there is a severe case of anxiety or depression, suicidal thoughts, I would definitely do a combination of allopathy and homeopathy, and then later maybe taper
Okay.
homeopathy. Also, like acute
Hmm.
panic attacks. There,
Hmm.
I gave my Bach flower remedies, mixtures of Bach flower remedies. I call it happiness drops. All
Okay.
those patients maybe who are watching today, they know about my happiness drops, which works beautifully. Hmm? So I gave it like a complementary with our homeopathy. And also acute panic attacks, there are times I would have to refer them to the psychiatrist. I'm always in touch with them. So be open to and respectful to other physicians who are out there ready to help our patient, because finally, what should be our motto? Patient benefit in whatever ways,
Secure.
right? Right.
Hmm.
So this is what my approach has been towards mental health. And I also believe something called as preventive psychiatry. That's why I keep on doing a lot of lives, and
Okay.
you see on social media and YouTube and podcast and everywhere. I'm just, one motto is preventive psychiatry, because more you reach out to people, tell them about signs and symptoms, make them aware, more
Hmm.
preventive health will set in. Why suffer when you can prevent yourself?
Sorry.
No problem. So this is what my approach has been. So let me tell you now, what else do you need from me? Any other questions you want to take, or should we give some tips to people? What do you want to do?
Ma'am, how to club different, as you mentioned, that you basically practice even complementary methods also together.
Mm-hmm. Mm-hmm.
So, how to club all those combinations together? Where do we draw the line that, okay, this is where we have to support the patient with complementary systems,
Mm.
or this is where we have to use homeopathy completely, being a classical homeopathy. So, we have to administer all those kinds of remedies.
Yes. So again, we have to know the strengths of homeopathy. Homeopathy is brilliant. It works brilliantly with psychosomatic disorders like skin complaints like urticaria, psoriasis,
Hmm.
eczema, acidity, reflux, ulcer, hair fall. I've got immense, very good feedback with hair fall, alopecia, hormonal imbalance. Then there could be, say, ulcers, warts, corn, molluscum, um, allergies. Superb. Homeopathy, just homeopathy on allergic rhinitis, it would work brilliantly, right? So, in most of these
Hmm.
psychosomatic disorders, in mental health disorders like anxiety, depression, OCDs, ADHD,
Hmm.
yeah. So here it works. Now, when do we know that allopathy comes into the play? Firstly, again, I would say a clinical experience. Yeah. You would know
Okay.
now the disease from SORA to psychosis to syphilis is going. And you know that you need to now, it's become pathological. For example, if you're treating allergic rhinitis, right? Homeopathy works well.
Hmm.
But when the sputum color changes to green, even if you have tried
Hmm.
that's secondary infection, by the way. Yellow or green is secondary infection. And you have to be
Hmm.
watchful as a physician that secondary infection, is it going to the otitis media? That means the ear infection. Is it going to pneumonia? Then, of course, you know that your treatment is not working and take a combination of allopathy. Diagnose the
Hmm.
patient perfectly. Diagnosis is first step even before the case history comes in,
Okay.
right? If a
Hmm.
patient comes to you and says, Doctor, मुझे पेट में दर्द है, as a physician, if you can't diagnose whether वो पेट का दर्द किडनी से आ रहा है, वो stomach से आ रहा है, liver से आ रहा है, then what kind of treatment can we give? Right? So diagnosis,
Hmm.
one homeopaths have to be like perfect in diagnosis, in reading the blood reports. Through blood reports, I have so many of my patients, they will vouch for it. I've been able to guide them the preventive health and you know what they can do. The protein could be less and what else can they do just through blood reports.
Hmm.
Okay. So be very strong in your studies of the medical approach and
Okay.
then take up homeopathy as a combination, right? Now, coming to your question of when do we take like a complementary system? Like, for example, I mentioned the diseases in that, for example, I gave allergic rhinitis. Now, say a bronchial
Hmm.
asthma patient comes to me. When I know the respiratory rate goes above 45, even with my constitutional homeopathy, going towards 50, I
Hmm.
would say, okay, nebulize yourself and do a
Hmm.
combination of homeopathy with nebulization, right? So again, a clinical knowledge, or say a patient with severe psychiatric issues having suicidal tendencies or schizos. I also get schizophreniacs. Then I
Hmm.
would suggest, okay, you need to continue allopathy for a long time, and I can give you homeopathy
Hmm.
so you can reduce the effect of allopathy and further, right? So these are few of the tips. Um, Also, the need for this alternative combination holistic therapy came to me, because I started seeing one thing. Due to chronic stress, there are three things that happen to a patient generally. Due
Hmm.
to chronic stress is a very big terminology under which everything comes. Due to chronic
Hmm.
stress, three major things happen to patient. One, physically, they suffer from psychosomatic disorders,
Hmm.
right? Second, they get emotional imbalance or turmoil. That means there is no balance. They'll get too happy, sad, there are mood swings, irritable. So that's the second thing. right? Third, the energy levels just drops down, no
Hmm.
matter what.
Hmm.
So for these
Hmm.
three, my approach again has been homeopathy, psychotherapy, literally hand holding my
Okay.
patient once a week. Details, I've also done my post graduation psychology. So psychotherapy with my bark flower remedies. And for low energy levels, I teach breath work. Meditation works brilliantly for psychiatric issues.
Hmm.
Okay.
Yes. Okay, ma'am.
All right. So I think we have spoken a lot. If people have more questions, just drop in on the comment, and um, will share answers. Do you want to take any questions? Any questions out there? People have commented. We love how Doctor treats us. Thank you, Neelam. Thank you so much. Um, very well said. Very informative. Thank you. Thank you. Kudos, Prerna, for bringing such nice sessions. Very insightful. Very nice. Thank you, Kabir, for that case history without judgment. Yes, great information. Okay, happiness drops of Dr. Yatri. Amazing. Thank you for that. Thank you for trying. Useful tips, doctor. Okay, and how to
So,
identify if a person is anxious. Uh,
anxious.
yeah, I have said this before, so just go through our live talk and you will know it. So, okay, let's end this session, Prerna, with something nice. Do I?
Yes, ma'am.
Yeah. Okay. You know, I truly believe that health is actually like a journey, just like my name, Yatri. Health.
Oh, that's so wonderful.
Health is like a
What an
journey.
analogy.
And while going through that journey, instead of just focusing to the end of the journey, try to experience as much throughout the journey. It will give you the best experience ever. Okay. So, with this thought in mind, I think we should, yeah,
We wrap the live session here.
awesome. Awesome. Okay. Thank you, Prerna,
Thank you,
for
ma'am.
having me
Thank
over.
you so much for coming here and sharing your thoughts and opinions. We are really glad to have you here at this platform.
Thank you. Thank you again.
Thank you, ma'am. Thank you so much.
Thank you.